presenter up. I can get to my schedule here. Is Dylan, and he's going to be presenting on an independent study of psychology in relation to individuals on the autism spectrum.
Researching how psychology relates to individuals on the autism spectrum. Research I have gathered, including understanding autism spectrum disorder, why cases are increasing, diagnosing an individual with ASD or autism spectrum disorder, and what forms of treatment and support are in place. I would also be explaining my experiences at Benhaven, so some background, research gathered, memorable moments, teaching examples, and also my experience at Chapel Haven, some background, research gathered, recap gathering, memorable moments. As I begin to search for possible career choices for my future, I struggled. I've always had an interest in the sciences, but where exactly would I best fit constantly became a roadblock for me. Eventually, I narrowed it down and decided a capstone would be the perfect opportunity for me to test my interest in psychology and autism development. On top of that, I plan to test that interest, develop a greater understanding for a field of study I'm passionate about, gain firsthand experience with individuals on the autism spectrum, and learn what is being done and what steps can be taken to improve the lives of individuals on the autism spectrum. One important factor before researching autism development is to first have an understanding of how psychology relates to individuals on the autism spectrum. Psychologists play an important role in diagnosing, researching, and helping families understand what challenges they are to face when raising an individual on the autism spectrum. On top of that, when researching autism development, I discovered how important it is for one to have a general understanding of psychology and statistics when it comes to interpreting data found by research and fieldwork. The autism spectrum exists along what is called a spectrum or continuum. Some individuals on the autism spectrum are able to go to school, work, and perform daily living functions with limited support. However, this diverse disorder leaves some individuals on the autism spectrum with severe intellectual impairments that will require support and assistance throughout their lives. As you can see in the diagram, it goes from high functioning autism, which is a level 1, autism, which is a level 2, and severe autism, which is a level 3. ASD, or autism spectrum disorder, can be recognized in individuals through characteristics such as repetitive behaviors and difficulties with social interaction. Below, I have listed some common signs and symptoms of ASD. So failure to make eye contact beginning in infancy, failure to respond to one's own name, unusual movements such as rocking, twirling, or flapping arms, difficulty understanding tone of voice, body language, and gestures, and difficulty breaking from a routine. Even though research tends to demonstrate an upward curve of ASD cases over the years, shown in this graph on the right, it is important to understand the reason behind this belief. As discussed in the book, Autism and Pervasive Development Disorders, edited by Fred Volkmar, it is important to understand the difference between prevalence and incidence. When compiling casual research, only incidence rates can be used. However, as both prevalence and incident rates are being improved, their rates will continue to increase. As also talked about in the book, the epidemic hypothesis that emerged in the 1990s is one of the many examples of this. The book explains, in most countries, increasing numbers were diagnosed with ASDs, leading to an upward trend in children registered in service provider databases that was paralleled by higher referral rates to clinical service and prevalence rates in epidemiological service. These trends were interpreted as evidence that the actual population incidence of ASDs was increasing. However, because methodological factors contribute to variability in prevalence estimates, these must be considered before concluding that there is true rise in the incident cases of ASD in the population. The graph on the right demonstrates the sort of effect. So estimates that rely purely on service, so these hollow dots from to time 2, rather than estimates based on population prevalence, so these solids right here, create the effect of rising prevalence over time. So from time 1, you can see how it increased at time 2. Diagnosing an individual with ASD. The age of diagnosing can range from as young as 15 months of age to adulthood. It is important, however, that an individual receives a diagnosis at a young age because early diagnosis allows for early intervention. I'll go into more detail in a few slides on a proven therapy that supports this statement. ASD is a neurodevelopmental disorder and has evidence pointing towards it being a genetic-based disorder. However, research is still inconclusive. Scientists have discovered recently that autism has occurred more frequently among individuals with certain medical conditions that have genetic causes. Conditions such as Fragile X syndrome, tuberous sclerosis, congenital rubella syndrome, and phenylketonuria, or PKU, are just to name a few. An individual with ASD cannot be diagnosed with medical tests such as blood tests and brain scans. This is where experts such as psychologists, pediatricians, and neurologists are required to diagnose the condition of an individual based on the patient's history and behaviors. It is imperative, however, for diagnosing the patient to have an extensive background and experience with a wide range of symptoms associated with ASD. Before the expert makes the diagnosis of ASD, they must first gather information. Patient interviews are one of the pieces of information gathered. Observations of patient behaviors, tests of cognitive and language abilities, medical tests to rule out other conditions, interviews with parents, teacher, or adults who can answer questions about the patient's social, emotional, and development. So referring back to this previous statement I made on the importance of diagnosing individuals at a young age, the Early Start Denver model is an example of a therapy that has proven to yield results in children who show symptoms of autism. The purpose of ESDM is to promote social and communication skills and learning between the ages of 12 and 48 months. Before ESDM can begin, however, it is essential for therapy to begin the moment autism symptoms emerge. The purpose behind this is to ensure effective intervention policies for children with autism. This includes various things such as insurance coverage and state support for early autism intervention. ESDM is originally based on methods utilizing an ABA, which is the type of therapy that focuses on improving specific behaviors such as social skills, communication, reading, etc., as well as adaptive learning skills such as fine motor dexterity, hygiene, etc. What makes ESDM different, however, is its utilization of play and joint activities, which allow for the patient to feel encouraged, promoting language, social, and cognitive skills. So what sort of strategies does ESDM use? ESDM focuses on building positive relationships, teaching during natural play times and everyday activities, and encouraging interaction and communication during these play times. Using ESDM holds many benefits. For example, the flexibility to perform the therapy at school, clinics, or at home in both group and one-on-one settings. The involvement of family and signs of the child benefiting from the therapy, regardless of what sort of learning challenges each one faces. One of the most important benefits, however, is that studies have shown years later, after the therapy has concluded, that the patient is still able to maintain a gain in overall intellectual ability and language. On top of that, some patients showed areas of progress in reducing autism symptoms. ESDM is not the only form of treatment and support. Several forms of interventions have been developed over the years to help treat individuals with ASD. As mentioned before, ABA, or Applied Behavior Analysis, is a popular method that uses evidence-based techniques to increase helpful behavior and reduce harmful ones that can have an impact on their learning process. ABA has shown to improve communication, social, and vocational skills. A form of treatment is known as the DIR model, also known as the floor time therapy. DIR consists of parents and therapists following the child's lead and playing together, whilst also directing the child to engage in increasingly complex interactions. Finally, the Teach Autism program works to promote engagement in activities, flexibility, independence, and self-efficacy through strategies based on the learning strengths and difficulties of people with ASD. Excuse me. Now, putting independent research behind, I would like to talk to you all about my field work or volunteer service. Benhaven is one of the 2 places I volunteered at over the course of this year-long capstone. Benhaven was founded in 1963 by Amy Leddick as a school for children with autism. Over the years, Benhaven has grown into a multi-phase facility that serves people of all ages with diverse needs. nonprofit organization with 4 program areas: Benhaven School and Residential Service, the Benhaven Learning Network, and Benhaven Individual and Family Support Program. I worked in the Rosenberg Center alongside North Haven volunteers, Danny, the head of the Rosenberg Center, and Stu, a full-time worker at the center. Benhaven is located on the border of North Haven and North Brantford and houses 5 adult patients with ASD. So, patient 1 is one, as my research, it was extremely important for me to keep names of each patient confidential. Researching, I assign each patient a number. Below I've listed each patient's number, the teaching strategies for each, and some distinct features I noted about each patient. Over the year, each volunteer was assigned a specific patient to work with. Mine was patient 1. However, in the first 2 weeks of working at Benhaven, I was able to work with every patient at least once to gather information. So patient 1. Teaching strategies I used with patient 1. Matching. So I would lay out an image of images of various nouns, verbs, and the patient would take the word that I would give him, and he would match the word to the image that I have laid out. Counting and writing number practice was, and I would lay out different numbers of bills, and the patient would count onto the dollar bills and write the number on a piece of paper. Another teaching strategy I used was retrieval. So I would name different objects on a list around the center, and the patient walks around to point them out to me with an attempt to repeat the name of the object when found. Some distinct features that I found about patient 1 is that he's very calm and laid back. He's very intelligent, quick to bring him into action. He cannot speak that well. However, patient 1 is always around the volunteers at the center, humming a lovely tune. After completing a matching session, patient 1 stacks the cards up and extends his hands for a low 5. Patient 2. Some teaching strategies. The main teaching strategy I used with patient 2 was sign language. To perform this task, I was to read aloud a word on a list, and the patient was to repeat that word in the form of sign language. With every correct answer, a high 5 was exchanged. Some distinct features I found with patient 2 is that he would tend to clatter his teeth frequently. When excited about something, patient 2 would begin to hum. Patient 2 also rarely showed any signs of anger during my time spent with him and was an extremely good listener. Patient 3. So similar to patient 1, patient 3 would go about, but this time it was include sign language. So a word, and he signs the word. He places the word on an image that I laid on the table and repeats the sign again. Some features I found with patient 3 is that he's very calm most of the time. Patient 3 attempts to be very mature and proper with his actions. From time to time, patient 3 demonstrates mature behavior without his surroundings. When patient answers, he becomes very aggravated. Patient 4. Patient 4 utilizes translation. So I would show him a phrase in English, and then he would repeat back to me that phrase in Spanish. Some distinct features I found with patient 4 is that he has an amazing memory. When you first meet him, he will ask you for your name, the name of each member of your family. Next time he sees you, he challenges himself in repeating your name and your family's names. Patient 4 is also able to tell you the exact day of the week, for example, your birthday, and tell you what exact day of the week it is. When having a conversation with patient 4, he will randomly clap his wrists together, either to show he does not know an answer or something is troubling him. Patient 5. So some teaching strategies I used with patient 5 was fill in the blank. So I would lay out a phrase with a blank and 3 possible options to fill the blanks that makes the most sense. Patient 5 will choose an option and read out the complete phrase. Patient 5 also practices with sign language. I would read out a word on a list and she repeats the word back to me in sign language. Distinct features of patient 5. Patient 5 is known as the Queen of Rosenberg Center. She is very particular in her placement and neatness of objects. If she sees something out of place, she will instantly correct it. With an excellent memory, patient 5 is always quick and precise during her sign language practice. I would like to talk about a memorable moment that I had at Benhaven. So go fish with patient 4. At the end of each session, the volunteers will meet up at patient 4 room to have a recap session on the work we did. I was playing Go Fish with a deck of playing cards. Go Fish is patient 4's favorite game and looks forward to playing it every time he sees us. During our game, patient 4 will randomly throw in an incorrect question, such as, has 3 legs. Wait for you to respond with a bet has 4 legs. Although these meetings never lasted more than 10 minutes, it was extremely valuable for me to see others that take time out of their day to help a group of people they feel extremely passionate towards. Before I move on to my final volunteering experience, I would like to teach a little bit of sign language. So if everyone can see me well, the first word or words that I picked up along the way are very simple words. They're almost straight word. So the first word, dog. You would take 2 hands, and you can't see me now, but you put them on your thighs, like a dog is about to jump up on your thigh. And that would be dog in sign language. Shave is you would make the shape with your hand and pretend like you're shaving. It's straightforward. An apron, for example, you would pretend like you're putting on an apron. And that would be apron. Finally, I incorporated this alphabet of sign language to demonstrate how a lot of sign language uses the and then complements them with actions. For example, Y right here. And if you put Y up to your mouth, that means you want some yogurt. Recycling is a very commonly used word at Benhaven. So you would make your fingers in the shape of an R and then pretend like you're making the recycling symbol. So, Chapel Haven was the second place I volunteered at over the course of my year-long capstone. Thanks to Gina Apicella, the Vice President of Autism Service, I was able to receive a detailed background on Chapel Haven and what sort of work they do for individuals on the autism spectrum. Chapel Haven was founded in 1972 by a group of 6 families. The families had children who went to school, graduated, learned skills, but did not know what to do with those skills. At first, Chapel Haven was called Maplebrook School and had 6 students, 2 staff, and 1 dog. The main purpose of this school was to teach these students independent living skills. In 1976, the school moved to where Chapel Haven currently is to start up what is called the REACH program, a program geared more towards individuals with intellectual disabilities. In 2006, this program became known as the ASAT, or Asperger's Syndrome Adult Transition. This is the program which Ms. Apicella is overlooking. This program, individuals that were high functioning but autism spectrum. Dr. Volkmar, in fact, was a major contributor in writing the curriculum. ASAT is a 2-year-long residential program at Chapel Haven campus with the main goal of minimizing the support given to the students. Some students will also always need some sort of support, for example, paying bills. There are 4 main domains that it covers: social communication, independent living skills, self-determination, and post-secondary vocation education, which includes exploring majors, programs, colleges, or even getting a job. Even though some students already have college degrees, they are entered into the program because they cannot live independently. Students can take classes every day from 9 till 3, with even some evening classes. The main focus of ASAT are to help students develop generalizing skills, problem-solving techniques, trial and error practice, and building confidence. ASAT also gives the option for students to live on campus. It's not required, but highly encouraged, since it gives the experience of independent living with faculty and aid if the student needs it. One of the main skills taught throughout this program is time management and scheduling skills. To help develop this skill, students start with small jobs such as working in retail, food banks, and helping with office tasks. One of the most common problems that Ms. Apicella explained to me is that students over time begin to develop a dependence on their peers, parents, and teachers. That is why it's important for students to live independently and develop the main focuses of ASAT. By completing daily tasks such as grocery shopping and traveling to the laundromat to do their laundry, students begin to develop independent living skills. Once a student is ready, they can move on to the CISO program, or the Center for Employment Service Opportunities, where they can find internships or a mentor for vocational study. When a student becomes ready for CISO, they can move out of Chapel Haven. However, typically, a student will rent out an apartment in a 1-mile radius of Chapel Haven so they can receive aid from an advisor if necessary. Ms. Apicella explained to me how she began to notice the pros and cons of students using technology. Some pros of using technology for individuals with ASD was that social media helped with their social anxiety. Certain chat sites, video games, also help students gain a sense of composure. Using this technology has been shown to help students with their social skills immensely. A major con to all of this, however, is the student can easily become addicted. If a student becomes unable to put aside their technology, they begin to lose focus of the program. Some students have even been known to be sent home because of this problem. Through my work with Chapel Haven, I was always able to gain firsthand experience of what life is like for residents living on campus. Alongside staff member Jason, I gained some firsthand knowledge on what the program looks like. Similar to Benhaven, Chapel Haven makes it clear to volunteers that names are confidential, so I will use patient 1 when talking about the individual I worked with. Every Tuesday evening, I met with patient 1. Patient 1 lives with another student in an apartment complex on campus. Once I arrive at the apartment in the evening, Jason and I go through a list of daily chores for patient 1 and his roommate. These chores can consist of doing the dishes, making sure their rooms and bathrooms are clean, keeping track of how much food they have stored, what they had for dinner, etc. After going through the checklist, Jason leaves the apartment, allowing me to spend interacting time with patient 1. Patient 1 is a very calm, gentle, and intellectual individual who follows tasks without complaint. Each time I meet with patient 1, our conversations vary. However, over the course of the first month working with patient 1, I began to learn about his life and interests. One of patient 1's many interests he shared with me was his interest in old-fashioned magazines, and even allowed me to look through them with him, showing he is comfortable with social interaction and demonstrates generosity. Patient 1 is also attending college, so some nights when patient 1 had a lot of extra homework, I would spend our time together, helping him or just plain observing. Patient 1 proved to have some high-functioning skills, such as reading, writing, and critical thinking, which demonstrated to me as he completed his homework. After meeting with patient 1 and going through a checklist of tasks, Jason, everyone in the apartment complex, so around 8 to 10 people, would meet up for a time known as recap gathering. To start off each meeting, Jason would ask each individual what their ups and downs of the day were. At times, the students would begin to go off topic and take control of the conversation. However, Jason would direct the conversation back to its mark. Once each individual had their turn, Jason would ask if anyone had any current events they would like to share. During this time especially, I was able to understand each individual's interest and observe how respectful everyone was by listening and adding onto the conversation at the appropriate times. Discussing current events allowed me to see how each individual is able to utilize technology in a positive way that helps further grow their knowledge of the world and society around them. Once everyone has a chance to share, the meeting became a time for everyone to speak their minds and interact with each other. So, a memorable experience for me during the recap gathering. One night at the recap gathering, the topic of global warming erupted. I was instantly impressed at how capable each and every individual was at maintaining the topic of conversation and being patient with each other. Not only was each individual able to speak their opinion on the subject, but back it up with statements and facts such as ice cap reducing by 20%, using scientific terms such as CO2 emission, and relating it all to capitalism. This moment not only opened my eyes to the future possibility of our society can have for these individuals, but what sort of opportunities we should be giving each and every one of them. Some ending notes. With countless experiences made and knowledge gathered, I can safely say that this capstone journey was the right decision. The unfortunate circumstance of coronavirus cut short my time at each organization. However, I developed not only a greater understanding of the field, but countless memories that I will take with me for the rest of my life. With the opportunity given by my mentor, I plan to continue this capstone as an internship so I can continue to see if the topic of this capstone is truly a career to pursue. Some citations. And I would like to make a special thanks and recognize Dr. Fred Volkmar for all the work he has done for me. I would not be able to accomplish any of this without him. Thank you.
Nice job, Dylan. What an amazing experience you had at both places. It's incredible. And did I hear you say that you're going to be doing an internship next year?
That is the plan. Coronavirus is really killing us all, but it's hopefully a plan over the summer and even in the fall to do some online internships and see what happens.
That's excellent. Well, I mean, the experiences that you've had up until the quarantine have just been absolutely incredible. Really, really impressive.
Thank you.
In terms of gaining, because you had a lot of in-depth conversations with the patients, was there anything you did in particular that helped you gain rapport with them, for them to be comfortable speaking to you and answering questions and working with them?
Well, for patient one at Benhaven, with him the most. So I became very comfortable, and certain things like me being a singer, for example, instantly clicked with me and him, because patient one tended to hum most of the time. And also some slight things that not everyone would pick up on, but after completing a task with patient one, I would give him a high five. And this high five will show that he has accomplished something and that he can be comfortable around me.
Awesome. Well, it definitely worked, because it's clear that you did, and he did feel that way. Let's see, a few comments here from Cheryl at Mrs. Robertson.
Hi, Ms. Robertson.
Yep. This was fantastic. This was fascinating, and I'm so glad that you had this rewarding experience. I'm so proud of you. The patients are so fortunate to have had them in your lives.
Me too. It was truly just an experience that I will remember for a long, long time.
And I think your mentor is raising his hand. He's looking to talk. I'm going to see if I could, on the Zoom call, if I could allow him to talk if he wants to ask a question. I'm not sure if this will work, but I'm going to try. Well, if you can hear me, Dr. Volkmar, you can put any comments or questions in the chat if there's anything that you'd like to see. I saw that you raised your hand a couple times, so that's why oh, he said, great job.
Thank you.
So is there anything in particular that you think you'll focus on when you move into the internship? Because it seems like you learned a lot of different pieces to all of this experiences. Is there anything in particular that you want to focus on?
I kind of want to stay in a relative field of study. It's not exactly 100% sure what exactly Dr. Volkmar has in mind for me, but I do hope to stay in the same field, of course, because it's just a continuation of this capstone, and I already have a background of it, so it would be just easy for me to just jump right back in and enjoy the experience.
Awesome. Well, that sounds great. Great job. I know that from the beginning of this capstone project, you had a it, and I'm happy to see it all come through.
Me too.
All right. Well, that concludes our presentations for this evening. Thank you, everyone, for joining. Nice job, Dylan. And for those of you who are listening, we have some more presentations tomorrow evening, and I hope that anyone that's here can join again tomorrow.